everyone. Welcome to today's episode of Attachment Theory in Action podcast. I am excited to welcome back Dr. Rachel Ahrens today. Dr. Ahrens is an LCSW, a psychotherapist, certified EMDR therapist, and author, and she's going to be discussing the early trauma protocol, her groundbreaking methodology for healing trauma at its roots. Dr. Ahrens has over 45 years of clinical experience, and she helps therapists understand the profound impact of pre-verbal trauma by examining the earliest developmental stages of childhood. So, hi, everybody, and welcome to this episode of Attachment Theory in Action podcast. I am very excited to have Dr. Rachel Ahrens back on the podcast for a second episode. Rachel, welcome. Thank you for coming back.
And thank you so much for having me back. It's a pleasure to see you and to be able to speak to your listeners again. That's great.
Absolutely. I know that we're going to dive a little bit further into the early trauma protocol and just those links between attachment and trauma, and even using some of your own examples that you have and your professional experiences that you've had with clients. And so I'm very excited about that. First of all, I wanted to take a moment to mention to our listeners that you have developed some free webinars that they can look out for on your website. We're going to be posting with the show notes your website link, so they will be able to go to the website and check that out. And you also, if you would like to tell us a little bit about an upcoming opportunity that you have taking place in Santa Barbara, I'm going to share my screen so I can show the folks the information on your website. But why don't you tell us a little bit about your in-person training?
Yes, this is very exciting because there are ways in which in-person trainings are just better for trainees than being on Zoom. They get me right there on site and I can supervise, and it's Santa Barbara's not a bad place to come and visit, especially in the summer. So in June, hopefully the weather will be nice and you can come. Instead of it's being spread over 3 days as it is with a Zoom training, this one is spread over two. So you're only going to be there on the Saturday and the Sunday all day. And it has the same 14 hours of CE credit, but as well, I add on a 2-hour consultation practicum, a session that is held as a follow-up about a month after the training, because people have questions by then, or they're struggling with a client, or they need some advice, whatever it is that would be most helpful. So that is included in, and we're starting something exciting and new too, which is the early bird fee. That allows people to lock in their space so they know they have that, and it gives them an advantage. It saves them $100 on the training. So I
Well,
attention to that.
that sounds wonderful. Of course, for the sunshine, but even more so for being able, as you said, to be in person with you, and really gain that experience that can only come from being in person and having somebody right there and really being able to get a full understanding of what's being talked about and delivered. And Rachel, I also love that you are offering this follow-up consultation. I'm a firm believer in that is the best way for us to really make long-lasting change and progress in our practice is not just doing something once, but finding ways to reflect on that process that you're going through, and being able to say, is this working in my practice? And if it is, great, what can I keep doing? If it isn't, what can I go back and relearn or try to understand differently so that it can be of benefit to me in my practice? So I just love that you're offering that consultation opportunity as well.
Yeah, I think it's really helpful. It's a lot of information to take in at one time. And so it is useful to have a chance to go back and look at what you might have missed or misunderstood or whatever. Yeah. So
Well, thank you for sharing that with our listeners. I'm going to stop my share for a second and come back to the screen. I wanted to talk a little bit about what we're going to talk about today in our podcast episode. So one of the areas of focus that you and I have identified and was really important for you to be able to share is diving into this relationship between trauma and attachment. And I know that, and not only that, but also the kind of how things show up within like the DSM and within diagnoses. And so I know that you've created a chart that I'm going to pull up and share again with our listeners so that they can see it. I'm just going to kind of hand over to you. Let's tell us more
Okay.
about it. Tell us about this chart and what it means and the theory behind it.
Absolutely. I'm happy to do that because this is my mission. This is what I'm about right now in my life. It's trying to spread the word about this methodology. And what some of you will be aware of is the fact that in the psychological world today, we have taken one important step. And that includes people that you may have heard of, like Bessel van der Kolk and Gabor Mate and a number of other therapists. And the step that has been taken is to see that behind all the diverse problems of adults, there is a commonality. And when I do a presentation, especially for the general public, I ask them to visualize a room in which various different people are sitting, and they are each representing a certain kind of problem. So there might be someone who's an alcoholic, or there might be someone who's a child molester, or there might be someone who has depression and anxiety, or someone who's struggling in their relationships and headed for divorce, and all the personality disorders, OCD and bipolar, and all these. Just picture this room packed with these individuals, all struggling with problems of what are on the surface wildly diverse presentations. And yet, what we're learning is that they all track back to something in common. And that's amazing in itself. That something is trauma. And where I go is one more step. And this step is crucial. That is, I look behind trauma to the source, to the foundation. And I find that answer in the very earliest years of life, in the relationship between parent and infant or child. This is where attachment disorders land. And they influence people, not consciously, but unconsciously from that time forward. So the work has to do with exploring what is insecure attachment and how is it different from secure attachment. And I really make a point of using a different methodology to help people understand those concepts, not in terms of analysis, logical analysis or analytic or research, but in terms of visualizing attachment photos. They help people to go to the source of the feelings they have about their own childhood. And this includes therapists studying this work, because I believe that the more you do your own individual work, the better a therapist you're going to be, as well as clients that you're working with who may have blocked off or may have romanticized the relationships they had early in their lives, but actually did have a lot of problems that are then reenacted over and over again in their lives. And we see that repeatedly in our clients. Those who have complex PTSD and others as well, who are repeating the same problems.
I'm going to stop the share for a second. What I want to do is I want to kind of pull apart a little bit of what you've just talked about. And the first thing that is really resonating with me is this idea that underneath all of these mental health challenges, or even just challenges that we are coming up against in our lives and in our relationships, can be founded within attachment, insecure or secure attachment. And I'm going to go out on a limb and I'm going to be vulnerable here and share a little bit about myself, because this is why it resonates with me, in that I am somebody, and if my family listen to this, particularly my husband, he will laugh, but I am somebody who is probably a little more on the controlling in nature, in terms of, when you said OCD, if something needs doing, I am typically the one to do it rather than asking for help. And um and I've reached an understanding in myself that I have expectations that are sometimes unrealistic for other people. Like, just because I want something done a certain way or in a certain manner, that doesn't mean that everybody has those same thoughts. And for me, I'm secure dismissive. That's my kind of attachment style. I'm mostly secure, but have a tendency to slip into being dismissive or avoidant. And to me, that just makes perfect sense. Like, okay, now I see how this is showing up in what I'm doing in my everyday life. And while I may or may not have a mental health diagnosis, there are things that show up in my life that I can trace back to that attachment experience, where a caregiver wasn't consistently showing up, or wasn't showing up for me emotionally. And so now I take charge of things. I don't want somebody else to take care of those needs for me. I do it myself. So I'm just kind of like, yeah, that makes perfect sense, what you're explaining. And I felt that too, because attachment is so foundational in everybody's life. It's that very first emotional milestone that you really go through, that it makes sense to me that it could also be the root of many of our challenges that we have.
Well, that's exactly what I'm trying to espouse, is the fact that the foundation of all those patterns of behavior are actually in the very earliest years of life. And when you make the connections, it just makes everything fit together. And ideally, will prevent you from having to continue to repeat those patterns, because you'll have a clearer emotional as well as cognitive understanding of where they come from. The other piece of that is that we don't just look at what went wrong, we also do a repair. And that repair changes your expectations of others and of yourself. It changes your concept of who you are, and can, through the process of doing that early trauma protocol work, change the way you live your life.
Tell me and the listeners a little bit more about this repair. Like, what are you referring to when you're talking about this repair?
Okay, of course. Well, I had mentioned just a little bit ago that I use attachment photos, and I start out by using them to help people have a clear idea of what secure attachment would look like. Because for many of us, we don't have any examples or models. We didn't have that when we were children, and we may not have offered that to our own children, as these things tend to go intergeneration, if I can say it.
Rationally, yes,
Yeah,
it's a hard one.
my word. Yeah. And so the point being that learning about what you missed is painful on some level and can be something you defend against. However, when you experience what secure attachment would have felt like, that's when you start to be able to feel differently about yourself. So you need an operational example of what secure attachment would actually feel like. And for that, we use the concept of the mythic parents. I do show a series of photos. There are photos that help you understand what you were missing, what you would have wished for, what you would prefer in the parents you choose, these ideal parents that you choose. They're not themselves photos of those parents, but they're just the basis for making those decisions. And once you have your mythic parents, then each time that you make a repair, you look at what happened in the bio family or biological family and how this set of parents would be very different, how they would treat you differently, how they would fix the issues that were hurting and causing the rupture in attachment, and they would change your sense of who you are. So people say things like, I feel loved. I feel valued. These parents are looking forward to my coming and they are dedicated to my care. I am important. I belong. Statements like that are statements that I get very frequently when we work with the experience of mythic parents. And
Is
that's,
there,
sorry.
I was going to say, is there ever a time when you would use photographs of the real parent in this? And obviously, you wouldn't have a necessarily a photograph of a secure moment with that parent and child. And so I know that there would be that limitation. But is there ever a time where you would use real pictures to help explore this?
What I think is relevant to the question you're asking is that there are some times, and this is not the ideal procedure, but there are some clients who are not ready to accept the limitations, usually of one parent, sometimes of both, but usually it's one. And in that case, they want to use their bio, let's say, mother in conjunction with a bio father, in the
Okay.
belief that everything would be fine if our mother had simply picked a different partner.
Mm.
And when that happens, there's usually a period in which they begin to recognize that maybe no parents are perfect. And actually, mom might have done the best she could, but there were ways in which she wasn't actually what that person needed either. And it can take some deftness of working with a client. You have to have some skill to help them begin to embrace the possibility that maybe they are not holding the clear picture of that, in this case, mother. And that loyalty to the parent can definitely affect their whole picture, not only of their family, but of themselves as well. So sometimes there's a stage where we actually allow them to come to terms with that. And it may not
Okay.
be both mythic parents to begin with. I don't use photos for that. I just use the experience they have internally of mythic parents.
Okay, okay. And that makes sense. My next thought, and I'd love to, we're gonna hear a little bit about your specific case studies for sure. But one other thought to kind of wrap this piece of the conversation up is obviously the focus of your work and your time with clients is the healing journey of them individually. Do you find that clients are also able to move to a place of healing or on a journey of healing with their parents if or caregivers if they're still alive and in the vicinity, geographical region where they're at and can have that proximity? Do you find that clients are more open to seeing if healing is possible?
I would say that that is definitely a choice, an area of choice. For some clients, the experience of their parents is what we call toxic.
Hmm.
And they just have to accept that they're never going to have the kind of relationship they want. And possibly they will never have any relationship.
Hmm.
The second possibility is that they come to recognize the limitations of parents as coming out of their own background, their experience with their own parents and their childhood. And they can recognize the limitations and still accept the parent. And sometimes there is a really open experience of new connection with parents. So it kind of runs the gamut
Hmm.
depending on the individual and what they choose when they've completed the work.
Hmm. And I mean, I love the focus on it being their choice. You know, this isn't a modality that dictates that once
Mm.
you've done the work for you, now you can do the work with the person or the relationship that may have caused that pain in the first place. You know as well as I do that when it comes to experiences of trauma and then, attachment disruptions, that the loss of choice and power and control is huge.
Right.
Be, because that occurs naturally in childhood anyway. Children don't have choice and control, because they're children, and because we have to keep them safe. And so I think that it's so valuable and important that the language that you're using with clients, that it's their choice, and it's either choice is fine. It's whatever is your choice is what's going to work for you. And again, you're being that secure base for them.
Absolutely. Yes, that's what I would have said is that I'm validating their experience and helping them make choices that are healthy for them.
Mhm. So tell us a little bit more about a couple of maybe of your most transformative, or the ones that really stick out to you, that where you've experienced a client that has been able to have this transformative change occur for them. Tell us a little bit more about that.
Well, there's one that is extremely dramatic, and I use it as a teaching element in the practicum training because we have their case study with their words. I have
Mm.
permission to use their understanding of what happened to them. And I also have a video in which one of my colleagues is acting in a role play, um, in my working with that client through the role play. And it's a very dramatic one because not only was this particular client a very severe case of neglect. I mean, she was literally left alone for hours and hours and hours by herself in a darkened room with no connection with her parent, who was going through postnatal depression and was not relating to her much. She was also a mother who wasn't very tactile, didn't give much affection. I mean, there were a lot of circumstances. She was also a baby in utero who was an example of failure to thrive, which is interesting. And she had a heart defect,
Mm.
which is potentially symbolic of her relationship to the world. She didn't feel like she wanted to be born at all.
Mm.
And when she was 2.5 years old, her parents and the doctor woke up, I have to say it that way, to the fact that she had a very serious condition that should have been treated when she was just a few months of age. And here she was, 2.5 years old, the oldest uh, patient
Mm.
to have that procedure. And it was horrific. it was 6 weeks of being tied down with tubes and in incredible pain, using tranquilizers to get through it. And nobody explained anything about what was going on with her. No doctors, no nurses, and her parents told her nothing, believing that she would just forget, which is one of the things I'm trying to overcome with this work, is the idea that don't have to worry about little kids because they forget. And that's simply not accurate. So what is very unique about this example is that she had a number of patterns of irrational and ritualistic behavior that made absolutely no sense to her until we worked on this hospitalization at age 2.5. And it turned out that all the details of that were being relived in exquisite detail with the relationship she was in the present. And the fact that she wanted to get out of that relationship, but felt incapable of doing so, because it was like being locked up in that oxygen tent with no contact, and it felt like death to her. So that's a very, I have to read it slowly because I start to cry. It's it's just so moving and so painful. And it's such an extreme example. And as a little editor's note, what's interesting about this woman is she became a doctor. And what kind of doctor do you think she became?
A heart surgeon or someone that works with the heart?
No, but she's a pediatrician.
Okay, okay.
A child medical doctor. And she worked in the ICU where there were tubes and problems that she said I was destined to be in this job because I knew that very early in my life.
I think one of the things that stands out to me so much is, your comment about we do this to children so much because we don't think they'll remember, they forget things. And actually I just recorded a previous podcast before we jumped on, and the very same theme came up for that individual, was that I had no idea that this was what was turning up in my current relationship, because I don't remember it I don't have words for it. I mean, I maybe remember it a little bit, but I certainly don't have the language for it. And so how could I even think about making that connection to what's currently happening in my life? And we have a lot of listeners who do work in this field, who do understand that is not the case. That as Bessel says, the body keeps the score, that we know it lives in our system, and is triggered by what's currently going on. But there are so many people out there who are working to support children who are not in this clinical field, that really, we do need to get this message to, teachers and doctors who don't have a psychological background, even down to, I think about like librarians, people who touch children's lives in whichever shape or form, need to have this understanding that what happens early in life can truly last a lifetime.
For sure. Yeah, the challenge, of course, is that because this early period, and I'm talking specifically about the period from conception, that early, right up to about age 3 or 4. And as you said, there's no language and there's no explicit memory either. So the challenge is, how do we make sense of the kinds of experiences that come up in the body, the negative sensations, and the negative feelings that are associated with each of these very, very early time frames, and that help us understand what went wrong. And then we move to how it could have been and should have been with the parents that were our choice.
And so let's talk a little bit about your interpreting negative sensations in the body, because this is what you're really getting at, right? This is the beginning stage of therapy or treatment. The journey is we have to recognize those sensations first and foremost before we can then apply logic or thinking or words to it. So tell us a little bit. You've got 15 areas to consider. Maybe let's focus on a couple that you think are okay, these are really impactful, and you can choose. Tell us a bit more about that.
It's a hard choice. There actually is a dozen. That was a typo, but and I guess the idea is that they vary dramatically and come from different sources and different information. For example, I may know what it was like for a parent to be pregnant. I may have some information about the stages of pregnancy, the trimesters, and what are some of the things that are going on during those times. So I might say to a client, do you think your mom had morning sickness? And do you think it affected the first 3 months of your life? And they may say, I don't know. Or they may say, well, actually, I know that she did. If I get the answer, I don't know, I use a method that goes back to Virginia Satir, who was a family therapist that I worked with many years ago. And her words were, if you don't know, make it up, and you will almost always be right. And so we do work with the unconscious mind, and the modality that the unconscious mind uses is imagination. So our imagination and what are called implicit memories, memories that are basically held in the body, are connected. And that way we get to understand some of the things that bore on what was going on at that time. It may also be personal history, like, oh, that was when, let's say I was 2 years old and my father walked out. Oh, okay. How do you think that felt for you as a little kid? And what do you know about how your mother was reacting? And did you get to see him? And so it has something to do with personal and then more generic history in those time frames. It also has to do with sensations in the body, and some of those lead into the kind of sensory work that many of the therapists are using themselves to help people understand what their feelings mean as interpreted through the body. Sometimes we're looking at, I mean, it's hard for me to mention everything. Obviously, I can't. We spend a great deal of time on this in the practicum training that I was mentioning earlier, because it's really important to be able to make interpretations that help the client make sense of what went wrong, and then also help them to have the kind of earned secure attachment they experience with the mythic parents.
You know, I'm processing what you're talking about, because I think that this is these are concepts that require quite a deep level of understanding and an open mind, in terms of, you know, using your example of maybe a mother who had morning sickness, and you know, how that maybe impacted the mother's feeling about being pregnant, about that baby. And let's just say too that this conversation is not, the purpose of this conversation is not to point fingers and lay blame to, you know, many moms go through morning sickness, many mothers go through postpartum depression, many fathers experience postpartum depression once the child is born. And the, you know, a lot of, and many caregivers are doing the best that they can with what they have. And so I want to recognize that. Um, I think it's, and highlighting the client example that you've given, that, often it's when these things build up and build up and build up, and that it's this accumulation of these negative or unhealthy events that are happening. And so, but potentially one of those events could be that I'm a mother and I have morning sickness, and it's an awful situation for me. And maybe I don't feel good about being pregnant. Maybe I have a moment where I wish that I wasn't, because this feels so awful. And how that could begin to lay the foundation for what comes afterwards. And if I don't have somebody who is my secure base during that time to say, yeah, that sounds like it's really rough, and if there's anything I can do, what can I do for you? And I say, oh, I just want to sit with you and just give me a hug and make me just feel better for a minute. If I don't have that person to process what's going on in my body, then I'm going to hold on to it, and it's going to be downloaded to that baby.
Definitely. I guess I want to agree with you that we can have empathy for the experiences that parents went through, at the same time as acknowledging that what they were working with from their own background, or what they were working with internally, may not have been sufficient to offer the kind of secure attachment that was needed. And we can hold both. We can understand it, and we can also empathize with the client experience, who's just a tiny little thing at that point. And another of those methods that I didn't mention, but is one on the list, which is really important, are mirror neurons. And mirror neurons is the impact of the therapist on listening to and feeling into their client's reality, and being able, sometimes quicker than the client, to acknowledge what feelings are coming up in them, in the therapist, that represent feelings that the client may or may not, you have to give room, acknowledge and learn were their reactions to the experience they were in. Does that make sense?
Yes, absolutely. I mean, and this is this is such a deep protocol. This is such a deep level modality with so many kind of layers to it and pieces to unpeel, and pull apart. But and how powerful as well, how powerful for a client to be able to have that, and you can use your client as an example, but to have that transformative experience of
Absolutely.
going there. Do you could you could you pinpoint when the change started to happen for that particular client? Was there a moment where maybe she felt, okay, these pieces are starting to make sense for me?
Well, it is a process, and it's a cumulative process. So we do have time. We get the best indication of the change that's in process when we identify, we call it the words, but it's the feelings that the client expresses about how they see themselves and how they feel themselves to be in the mythic parents' experience. And as they begin to say those things, I gave you examples of what people would be saying out loud, it gives them you watch them change in front of your eyes. People that look miserable start to smile. They start to radiate a sense of, they sit up straight, a sense of bliss in some cases. And it grows. One of the things I'm working with now that wasn't in the methodology prior is helping people to refer back to those experiences. So not just experiencing them in the course of the therapy, but over the week between sessions. Can you think about what it felt like to be with mommy and daddy being mythic parents, to feel what it was like to be loved by them, to feel what, and find ways to do that. Some people do it creatively by writing, by doing artwork, by listening to music, by walking, by whatever way works for the individual. But it's a way that you're giving extra power between sessions to the experience that is in the session.
Right, because this isn't something that can be fixed or changed or healed overnight. This is there's always going to be things that are going to spark or trigger those previous thoughts of I'm not worthy, I'm not loved, I'm not cared for. And so I think that that's wonderful that you're, finding ways to help an individual to maintain and, not fall back into those thoughts and patterns.
Yeah, that's really important. And that there are, I wasn't going to get into the details of this, but there are prerequisites for this work that help make it less likely that people will be triggered or will go backwards, that support their emotional regulation.
Well, that might mean that we have to bring you on for another episode so that we can dive into it. But for now, Rachel, I just want to say thank you, and I appreciate the opportunity to just dive into this further with you. I feel like this conversation will have added more clarity and absolutely more context to what we discussed in our first episode together. And I appreciate the ability that you're able to share a client's true experience, and my thanks goes out to that client too for being willing to share her story. So I want to encourage my listeners again to go to your website and also check out your in-person training. Just a great experience that can happen in the sunshine. I think that would be wonderful. And hopefully we can have you back again.
Well, thank you so much for saying that. And I hope that people will look into the free webinar. It's just it's an introduction, in some ways similar to this, and just depends on what got brought up in our sessions and how similar it is, but it certainly bears repeating. Yeah.
Absolutely. Absolutely. And we will make sure that we post any links with the podcast release and in the show notes so that our listeners will be able to access that.
Well, they'll also get to see attachment photos, which right, which are not something we can show here.
Absolutely.
Yeah.
Absolutely. So thank you so much, Rachel.
My pleasure. Thank you for having me.